So today, on the occasion of Suicide Prevention Day, we have Dr. Deepak Raheja with us. Sir, what message you would like to give to our viewers on Suicide Prevention Day?
Thank you very much. It is a pleasure for me to be here today. And
So today, on the occasion of Suicide Prevention Day, we have Dr. Deepak Raheja.
and interestingly, about suicide prevention, which is um, the theme. The suicide prevention is the theme of the Suicide Day today, and I would definitely like to reach out to the viewers by exclaiming that mental health is serious, and we should think about looking after our mental health. So I think people are perceptive today. They look after their physical health pretty well, but often enough we ignore our mental health. We don't do enough to nurture ourselves, and then we take it for granted. We don't feel that we need to do much about it. We take our emotions and thoughts for granted. We don't. We're not willing to understand that it is the inner world which reflects the outside world, and I think we need to learn the art decluttering ourselves, and when we don't, uh, we get depressed. We mess up our thinking. We mess up our emotions, and eventually messes up our behavior. So I think it is important that we rise and awake to the people need to be careful and look after their mental well-being. And as we do that, I think the number of people who will be depressed enough or impulsive enough to decide to end their life, which is I think the saddest thing that can happen to a human, to prematurely decide to finish their life. I think if you for a moment painfully enough put yourself in their situation, we realize that the agony and the pain that a person who is in that frame, that the pain of ending life is less than the pain of living the life through, and that perhaps pushes them into seeing the world with a morbid connotation to decide that they don't want to belong anymore. And I think each and every suicide is preventable. It is nothing mind. It is a state of psychiatric morbidity. It is a state of psychological distress. And if we can't play God, and I'm sure we can't stop and prevent each one of the suicide, but I think in our clinics, in our practice, most of the mental health care professional are able to prevent many people from taking that extreme step. So I think we need to go beyond the myths that surmount the human brain, the human thinking about intervention, about seeking help, about believing that asking for help means that they haven't been able to handle their life, and that essentially they are weak individuals, where on the contrary, asking for help is a sign of strength and not a sign of weakness. So I think it is very, very important that we work towards creating better mental health, so that people don't finish and lose their life. We don't lose these beautiful lives. Each life is precious, each life is beautiful, and each life is here on this planet amongst us with a purpose.
Okay, thanks, sir. Sir, how a person will come to know that he or she is depressed? Like, is there any symptoms, or how will they will come to know
So,
about that?
see, I think most of people. I mean, so suicide has been hugely debated. Is it just purely psychiatric? Is it purely psychological? But research into suicide and the causes of suicide makes us now conclude that suicide is multifactorial, and as much as it is a state of psychological morbidity or a morbidity, it is also a sociological issue. And sometimes people are not depressed, but they are driven because of extreme circumstances, or in that moment of impulsivity, they can't think beyond, and the circuit in their thinking goes kaput, it goes haywire for them
Hmm.
to believe that life is not worth living. But most people, a lot of people who contemplate suicide are often enough depressed, and the signs and symptoms of depression are pretty obvious and pretty well known, which includes sadness of mood, which includes morbid, dark, sad thoughts, which means feeling that life's not worth living, feeling that you don't want to do anything. There are regrets for the past. There is helplessness for the present, and there is hopelessness. All put together, it takes away the will and the desire of the individual to participate in any pleasurable activity. We might enjoy simple things that give us pleasure, like eating food or socializing, or meeting people, or even contemplating spiritual activity. So all of that put together just leads to a very sad, sorry state, and I often say it's a wearer who knows where and how the shoe pinches, because the sadness that's experienced by a person who's going through clinical depression is so unique, it is so personal, it is so subjective, that I think for anyone else to claim that they can feel it would be sounding so unempathetic, and would sound so judgmental. So I don't think sympathy is what a person who's depressed needs or deserves. It's empathy. It's trying to tell them that you understand what they are going through, rather than telling them that you can feel what they are going through, or trying to tell them that they could shrug their worries away, they could shrug their symptoms away, trying to tell them that, come on, it is okay, let's go for a drive, it's all in your mind, if you meet people, if you socialize people, you'll feel better. All of us, when we meet people, when we socialize, we feel better. But unfortunately, these simple, trivial tasks are so mammoth for a person who's depressed to even imagine, forget about partaking or participating in an activity like this. So I think subjectively, an individual feels very morbid, but the individual feels that possibly there's not much one can do, and at that point, to even try and muster faith in a clinician who's trying to tell you that you're going to be okay is so difficult. And objectively, the family sees all these, and I think these are the times. We're not here to advocate that you must see a psychiatrist. We say there is a a plethora of specialist professionals who can help, and these can be psychiatrists who's a trained doctor who can, by giving you the right patient, by doing psychotherapy and counseling, can help you feel better. A psychologist who, by virtue of talking to you, can make you feel better. And then a whole lot of other resources that are always available in society, whether it's a guru, whether it's a spiritual teacher, whether it's yoga, whether it's meditation, it's exercising, going out, participating, doing social activity, trying to do emotional release by various mechanisms, trying to do a massage or a spa. Everything helps. So put it together, and don't leave a person who's depressed alone, and try to tell them that they will get well on their own. Yes, they will get well on their own, because most of these mood disorders are mood-creating disorders. So left untreated, they will get well. It's a cycle that goes down, will come up, but that may take a long time. And in that time, unfortunately, some of the people going through it so morbid and so dark stream go through an extreme form of emotion that drive them into contemplating self-harm. So to each suicide that is committed, there are 20 uncommitted suicide who are going to harm themselves. So I think as society, as friends, as fellows, we need to be perceptive and we need to keep a vigil eye so we can spot somebody and provide the right help at the right moment, which can make so much of a difference.
Sir, I completely agree with you. Like, seeking help is very important. But, sir, do you agree that anxiety can sometimes push a person so deep that they can develop suicidal thoughts, especially during this pandemic time?
That's a very important and very useful question. That it's not always depression that drives people to commit suicide. Sometimes the anxiety becomes so overwhelming, and one of the key feature of anxiety, it messes up your thinking process. Your thoughts become confounded, and there is so much of arousal. There is so much of catecholamines in your system, in that state of sympathetic arousal, you can't control yourself, and you go haywire, and all the emotions and thoughts, they get confused and short-circuited, sometimes driving people to contemplate harming themselves. So one of the key example that you've cited is the current COVID situation where people have had to deal with a unimaginable, unprecedented situation. There were lockdowns, the whole world came to a standstill, and everything that we do to recuperate, to feel good, to socialize, that came to a grinding halt. And because people, the society was not used to handling it, a lot of people who had a diagnosis or a vulnerability for anxiety or a depressive disorder began to crack down and had extreme forms of anxieties or depression. So yes, these can be very tricky and very trying situations where to the vulnerable few who have a diagnosis, and these vulnerable few are not weak people. It is only if I draw an analogy to a physical condition. Somebody has a diagnosis for diabetes, so you don't say he's weak and he has diabetes. So somebody has a diagnosis for or a propensity for anxiety disorder, you don't say they are weak and they couldn't handle themselves, so they became depressed. That's very unfair and very judgmental, and that's what, as a society, we start doing, which prevents people from coming out and seeking help. I think that's one of the biggest challenge, because as a society we want to judge them, we want to tell them their imagination and it's there in their mind, and they can possibly talk themselves out of it, and so the person keeps trying and keeps believing that to ask for help may not be good and may only be reflective to friends and family as me cracking down, or me not being strong enough, or me needing a pill to get well. Please don't put yourself in such thoughts. I repeat, to ask for help is a sign of strength, and as a society, it is very important for us to stand by each other so we can encourage people to come out of the closet and stop brushing things under the carpet. And I think on this important International Suicide Prevention Day, my message to the masses, that let's stop judging, let's stop being unempathetic, let's stop being cruel, because I think when you judge somebody and tell okay, and you trying to tell them they are not so unwell, and you're trying to tell them that they possibly don't need help, and some of them may eventually succumb because of that fear of judgment, why you may never come out to seek help.
Right, sir. Sir, next question is, there was a news last week in paper 195 people died of suicide in Noida since March. So, any views, like any viewpoint of yours on that?
So there is sometimes we see that suicides also have a trickling domino falling pattern that can culminate into sometimes mass suicide, sometimes the pattern that you see with suicides in farmers and agriculture field, where you'll find a few of them in a zone committing suicide, and then it's a trend that a lot of people end up harming themselves. So I think it's reflective both of a serious time, a serious situation, this whole COVID situation, which has just changed the world in so many ways, is sometimes is not sometimes at point extremely challenging and difficult for a lot of people, and I think then that can have a vicarious, unfortunately negative role modeling effect to some people who are already unwell and who are impulsive and who are contemplating harming themselves, and then they end up taking this extreme step too, which is very sad.
Correct. Yeah. Sir, but how to talk to someone about the suicidal thoughts as a friend or a parent? Because people have the social stigma in their mind. If they discuss, people gonna judge them. So how they can share with someone they have suicidal thoughts?
So I think again it's very unfortunate, and it's a myth where some who are expressing that they have a thought to harm themselves are judged by others, and are told amidst themselves, or told to the patient that those who contemplate don't do it, those who voice it don't do it, and thundering clouds don't rain, and some stupid analogies people give, like barking dogs don't bite. I mean, it's so unfair to, but these are real life frustration examples sometimes
Yeah.
given by the family to somebody who's in distress, who's reaching out and asking for help. So let me just also share with you that research shows that 7 on 10 people, before they contemplate harming themselves, express that desire to somebody close to them in the preceding 2 weeks. So if this is not a cry for help, then I need to understand what is a cry for help. This is about to ask that I need help, and please do something about it. A lot of time it's discounted, it is judged, it is brushed under the carpet. We believe, and sometimes also some inexperienced clinicians also believe, or in society we believe, that by asking somebody about their suicidal impulse, if they didn't, we'll possibly implant that thought. This is a big myth and a misnomer. It is a wrong thinking. If you ask, the person yes, and will just brush it away if it was irrelevant. But if it was relevant, you will see a plethora of emotions on the face of that person. The person will probably break down, tears rolling their eyes, and you would know that this is somebody who needed help, and you could provide that help yourself. I mean, everybody doesn't need to go to therapists. Counseling happens with friends in community. It's called community counseling. The best counseling can happen within the family. The best counseling can happen with somebody you love and trust. So be the judge. Just hold the hand. Give a crying shoulder. Give a patient hearing. Listen to the person. Let them talk out. And once they unbaggage themselves, offload themselves, a lot of steam goes away, and they begin to feel better anyways. So we're not saying that there should be psychiatrization or psychologization of the society, and everybody needs to run to mental health care workers. I'm not implying that at all, because most of this interplay of emotional expressions will happen in society. And I think what the mind does not know, the eyes shall not see. So it is important for the society to be more perceptive, more sensitive, more vigilant, so they can spot the signs and keep providing help. And when they see that there are warning signs that they are unable to deal with, at that moment, I think to ask for help from a professional is a very wise thing to do.
Yeah. Sir, on another hand, how a person will come to know, like someone wants help or understand if someone is giving you hints? How do you understand his or her hints?
So let me tell you, there are actually hints. People who are seriously contemplating harming themselves say it in as many words. They don't give hints. They don't go via media and talk about trying to make you understand. They are vocal. They will tell you. And sometimes for a clinician like me, it is important for me to ask than not ask. I need to not take it for granted that if it doesn't look like, possibly the individual doesn't have a self-harm wish. So similarly, in society, within family, with friends, if you cannot hold on to that impulse, not be fearful, if you know how to handle it sensitively, it's good to ask. And if the person is going through that emotion, that will tell you or will ask you for help or will tell you that they are in dire straits and they're not feeling okay, and they're not in the right frame, and that's the point where we need to hold their hand. If they're depressed, we need to get the depression treated. If they are extremely anxious, so I think all of this should be left to the purview of a trained mental health practitioner who's trained to identify and then to treat. But in society, I think we can provide the emotional sensitive support, what's called as emotional first aid. All of us can be equipped to provide that emotional first aid so that these lives can be saved, and important lives, I repeat, are not lost prematurely. I think if I may request, we may take one last question because I have another webinar
Yeah.
to go to. So please, one last question.
Yes, sir. So, sir, we have the last question. Are there any training sessions for the patients who are undergoing these type of thoughts or taking any medications to control these urges?
Sorry, come again. Can you repeat?
Yeah. So, sir, are there any training sessions for such kind of patients who are going through these kind of thoughts? Like any
No.
special?
I don't think it's again trivializing and can sound judgmental to say some training sessions can help. Not fair at all. These are people who need serious help, which can be provided by trained mental health professionals like psychiatrists, psychologists, and counselors. The emotional first aid, as I spoke about, if it is an impulse, if it is that movement, then the mind needs to be distracted. That movement needs to be prevented. That emotional anchoring, emotional support at that moment need to be provided, which can happen in community and can be provided by friends and family. So there are no training sessions or so-called psychotherapy sessions or psychotherapeutic learning or cognitive therapy is for people who are going through various psychological issues, but not a suicidal or a suicidal thought.
Thank you so much, sir, for a wonderful session. And we have some
Thank
questions
you.
from the audience also. We will like send them the
So we
reply.
can take it in our next. Yeah, just if you can send it across to me, I'll be very happy to write a personal email and to address each one of them. I feel very happy to be here at this point talking about suicide prevention. It is the World Suicide Prevention Day, and I think as a society to be able to care for the mentally ill who's unwell enough to contemplate harming themselves is the prime and utmost responsibility of society, so we don't lose people, beautiful lives who are here for a purpose and who can continue to contribute to their own well-being and to the well-being of society. Thank you very much.